Welcome back to Road to Recovery, brought to you by Orthopedic and Spine Centers of Wisconsin. Riley Jauch here with Dr. Joe Sizensky. Joseph Sizensky, he's a board-certified and fellowship-trained orthopedic surgeon specializing in foot and ankle reconstruction. Treats a variety of foot and ankle conditions and injuries, including foot and ankle trauma, sports injuries, deformity corrections, bunion and hammer toes, and arthritis and diabetic foot and ankle problems. Today, doctor, it's been a rough couple of weeks for the Green Bay Packers. 2 weeks ago, we had Tucker Kraft go down with a torn ACL, so he talked to your compadre, Dr. J.J. Prosser, and now Elgton Jenkins is confirmed out for the season with a broken fibula. So not great up in Titletown right now, but for our audience, can you first tell us what is a broken fibula exactly? Where is that on the ankle, and what does that look like?
Yeah, so the fibula is the skinny bone in the leg that starts up by the knee and runs all the way down to the ankle. It helps stabilize the ankle, and it's also the attachment sites for a bunch of muscles. It is commonly injured in sports, particularly tackling or contact sports like football.
Okay, how is it different from? I understand this is a fracture we're dealing with, but how is it different from a high ankle sprain, or what does a broken fibula look like compared to another ankle bone that gets broken?
So the broken fibula is where the bone itself is disrupted or fractured. A high ankle sprain is when you tear a specific set of ligaments, which are the two ligaments that connect the tibia or the big bone in the leg, the shin bone, and the fibula. There are also ligaments on the inside and outside part of the ankle, and they all play a role in the stability of the ankle. But a fibula fracture in isolation is just a fracture of the bone.
Okay.
The injury can involve a multitude of different injuries. You can have a fracture of the bone plus other ligament and cartilage injuries as well.
Okay. And how do you know whether it's a fracture with just fibula injuries in general? When do you know that surgery is required, or how common is it where you can do non-surgical methods to recover?
Yeah, so the basic thing we have to figure out from the start is whether there's a fracture or not, and that's easily diagnosed with an X-ray. So we would definitely get an X-ray on someone, and depending on what that looks like, the next question would be, is this a stable injury? And that's an injury where if you apply a force, the joint would move within its normal range of motion. If it's unstable, then the joint will move outside of its range of motion or abnormally. So we have to determine if it's stable or unstable. There are certain things on the X-ray or the exam that would lead us to determine that it's unstable. If we can't, then we have to do something different, maybe a stress test or an MRI, determine if there's a ligament injury in addition to the fracture that's causing this to be unstable.
Okay.
So a stable injury could be treated non-surgically.
Okay.
And an unstable injury would be treated with surgery.
Okay. So we don't know whether Elgton Jenkins had a stable or an unstable injury, and we know obviously you're not treating him. But what's the recovery time look like for both unstable and stable injuries with this?
They're relatively similar overall in terms of return to play.
Okay.
So if it's stable, we would treat that person in a boot brace, protected weight bearing. They'd be allowed to put some weight on it, but not without the boot to protect it. And then usually within 4 to 6 weeks, we would start more aggressive rehab. And the return to play is probably in the 3 to 4 month range. Mm-hmm. For a fracture, you would generally get to surgery pretty quickly. It's probably a little bit longer period of protected weight bearing, more like 6 weeks, and then a period of kind of partial protected weight bearing after that, and then more aggressive rehab. But in the end, the return to play is probably more in the 4 month range.
Okay. And I believe we know that Elgton Jenkins underwent surgery and more than likely going to be out for the rest of the season, unfortunately for us Packers fans. So when it comes to that recovery, are there any risks of improper alignment or of limited mobility coming back? Or do people typically recover 100%? They're back to where they were before the injury with the
Yeah,
broken
usually by 1 year, the vast majority, say 90+% of people are kind of back to baseline. So in the long run, you generally get back to where you were before the injury. But it does take a little bit. Again, you can return to sports at 4 months, but you may not be, back to quote normal, for even closer to a year.
Okay. So you mentioned back to play 4 months, probably back to 100% in a year. What are some benchmarks that you as a doctor are looking for during that recovery process where it's like, okay, now we can let them do X, Y, and Z, or now they can do this and this? What do you look for during the recovery?
Yeah. So we just kind of go through a process. So we want to get the range of motion back. So we work on that. Once that's back, then we get more interested in getting the strength back. And once the strength is back, then we move to the next phase. So you might, do some light jogging. And if you can do that and you're, not terribly painful, your ankle remains stable, then you move to kind of, running. And then once you're running, then you can move to the more specific parts of your athletic career, whether it's cutting and pivoting or jumping or whatever is needed to do your particular sport.
Okay. And you mentioned that the cutting, the pivoting, the specifics. Are there any differences in recovery, or would a broken fibula impact, say, a wide receiver or a DB more than a lineman in this case, or is it pretty similar across the board?
I think for the most part, there is a risk of some stiffness, but in the general population, but in the professional athletes, they're rehabbed so well that generally that isn't an issue. It may take a wide receiver a little longer to get back to baseline, but ultimately they should get back to baseline.
Okay. And is there anything that you can do after you're recovered to prevent re-injury? Is re-injury common with these? I mean, it's your bone heals and feel like you're back to 100%, but is it common?
Yeah, the bone heals. If there's a ligament injury, then you're at risk for re-injuring that ligament. So in general, if you have a sprain in the past, your risk of having another sprain is about 3.5 times greater. So maintaining the motion, stretching before and after, maintaining the strength, and probably using a brace are probably the most important things, more to address the ligament end of it than the bone end of it.
Okay. That makes sense. And now for you specifically at Ortho and Spine Centers of Wisconsin, how do you guys treat these injuries differently, or what do you do that's unique?
Yeah, I mean, there are all kinds of ways to treat an ankle injury. I think the most important thing is to diagnose the patient correctly. So if they have a fibula fracture and it's non-displaced and it looks like it's stable, you can treat that non-surgically. But if they had a syndesmotic injury or a high ankle sprain, or if they had a cartilage injury inside the ankle joint, or they had a deltoid ligament injury, those all need to be addressed. You can't ignore those. So I think the biggest thing in these people, particularly an athlete that has to be at prime performance, is to not miss anything. So a lot of times we'll do an arthroscopy of the ankle before we fix it and see if there's a cartilage injury. We can look directly at the syndesmotic ligaments and the lateral ligaments. We can stress the ankle under arthroscopy and see if it opens up. So those are the things that I think determine ultimately how well you're going to do. It's not necessarily the fracture. That's the easy part. The hard part is all the soft tissue injuries that are very easy to miss. And if you miss them, that's going to be a chronic source of pain and other issues.
Okay, and you brought up the arthroscopy there. Are there any techniques like that, or maybe that just you guys at Ortho and Spine Centers of Wisconsin employ, like advancements medically that have helped make diagnosis of these injuries and recovery better and easier?
Yeah, I mean, I think imaging, I think a careful exam, and then the stress examination where you're actually stressing the ankle under X-ray, and you can do that to agree in the operating room, but um, before you get to the operating room, you have to make a decision as whether do I need to go to the operating room. So a stress exam in the office can be helpful in many cases.
Okay, and last one for me, for you as a doctor, what's the most rewarding part about this for you, watching someone get hurt on the field and make their recovery all the way back?
Yeah, I mean that's it right in a nutshell is getting somebody who can't even put their foot on the ground because it hurts too much, or it's so unstable it just buckles, and then returning to returning to play, returning to their regular job, returning to home and playing with their kids. All of that is the gratification that you get out of doing that, and seeing that is, it is very gratifying.
That's amazing. Appreciate your time, doctor. If you want to learn more about Dr. Sizensky, head on over to orthospinecenters.com and learn more about everything that Orthopedic and Spine Centers of Wisconsin does, especially if you have a broken fibula, torn like Elgton Jenkins, a torn ACL like Tucker Kraft. They are the go-to spot. So really appreciate your time, doctor.
No problem, anytime.
Thank you. This has been The Road to Recovery, brought to you by Orthopedic and Spine Centers of Wisconsin on ESPN Madison.